The most meaningful piece of my practice is taking people that have lost that, but still have that aspiration or goal somewhere deep inside. And so to your question, I try to reel in those dreams and those hopes and those identities somehow. And you clearly fail sometimes. And honestly, when I do fail, I consider those people almost hopeless. So unless it's a mission critical.
Hello, everyone, and welcome back to another episode of Wellness at the Speed of Light podcast. I'm your host, Dr. drsinicropi. On today's program, could not be more excited than to welcome internationally recognized neurosurgeon Dr. Robert Masson, who is an absolute pioneer in his field. He has performed over 13,000 spinal surgeries and has an amazing practice, having people fly in from all over the country, including famous athletes, all types of weekend warriors, high-level executives, and people that are just looking to restore their lives back to normal functioning. He is a big proponent of minimally invasive, non-muscle stripping type procedures where he tries to really do the most minimal access surgery to get people back to a better quality of life. Now, Dr. Masson has been a tremendous inventor over his career. He is the inventor of the IMAS 360 system and now is working on a project which I believe is going to tremendously revolutionize the way that the operating room management works. His company is called Expanded Existence, and it features mixed reality headsets for the entire staff, which allow them to have a very streamlined view of the procedure that is happening, allows for reduction in waste, allows for improved flow state within the operating room while the procedures are done, allowing them to be done faster, more efficiently, and more safely. But as importantly, it may save a tremendous amount of money to the system, and we're really excited about the rollout and seeing how this really takes off, both in this country and out of the country. Now, more about Dr. Masson. He is an avid sports enthusiast, still participating in almost every sport you can think of. He's an excellent basketball player. He is a race car driver. He walks the walk and really wants people to maximize their lifestyles, maximize their ability to live their best lives, and really looks at the person in all of their totality, trying to get them back to doing what they love doing. And that is why I'm so excited to have him on the program today, because I could not be more in tune with his mentality and the way that he is approaching both spine surgery and his life. On that note, let's dive right in with Dr. Masson on today's episode of Wellness at the Speed of Light. I really hope you enjoy this episode as much as I'm going to. Welcome back, everyone, to another episode of Wellness at the Speed of Light. I'm your host, Dr. drsinicropi, and I could not be more excited to have a pioneer in the field of neurosurgery on the show with us today, Dr. Robert Masson, who is currently in Orlando at Masson Spine Institute. Notice I said Masson because that is actually probably the most correct, accurate way to say his name. But we are so thrilled to have him on today to talk everything from what is his why to minimally invasive spine surgery, through the revolutionary use of mixed reality headsets and AI in making the process and workflow of surgery much, much better. I'm so excited on that. And we're going to be on this AI theme for a while. And I think over the next 3 to 5 years, the changes and revolution that's going to happen in the medical industry is unprecedented, to say the least. So welcome, Dr. Masson, to the program today. and so excited to really pick your brain. So I think the best way to start off is, why don't you tell us a little bit about who you are as a person and why you are so passionate about doing what you do.
Talk to you about all these things. But for me, everything you're doing at the amazing, sophisticated level in wellness and spine surgery and independent practice and health, the change of the next generation of spine surgery is happening right here, right now. And I've been kind of eyeballing this change literally for 27 years. And when I was a young resident in the early 90s, Rick Fessler, he's an icon in minimally invasive spine surgery and endoscopic spine surgery. He was my spine professor, and we were already doing, least invasive decompressions. And so we grew up in that culture. Cranial was a culture, but it was so obvious to me that the why of minimally invasive, of endoscopic, of least invasive procedures wasn't mature. And I was watching orthopedics and this little arthroscopic awkwardness that eventually became sports orthopedics. I was like, the spine needs to be like that. And literally it was 1994, 5 when I was chief, and I was starting to talk like that, and people looked at me like I had 3 heads. But my entire career, I've been just crystal clear that spine surgery really needed to be about return to who you want to be, and functional recovery and lifestyle recovery and crisis management rather than disease management. And yet, I've always felt like everybody approached it from a disease management perspective and a disability projection management. And that wasn't why I was motivated to do this. My motivation was very personal. I'm like you. I'm a lifelong athlete, and my whole family infrastructures are built around sport and competition and adventure. And so, when I've gotten hurt, my goal structure was never, oh, I guess I can't do it anymore, I'm getting old. No, it's always been, okay, how do I build the strategy, the habits, the process, and surgery plays a role in all this stuff. So to the question of who I am, self-proclaimed passionate wannabe athlete, lifelong, with an amazing goal structure. And by the way, I'm a neurosurgeon and I focus on spine surgery. So that's kind of how I define myself.
Wonderful. So I think 2 things that really stand out there that I want to pick, and I actually talk about this a lot. I think that from a standpoint of kind of who you are, and I love the way you said, oh, and by the way, I'm also a neurosurgeon, because I think that if we think that way, and we are able then to see ourselves as people that also have the same goals and dreams of our patients and who we're taking care of, as opposed to, I'm the doctor and I have all these tools and you're the patient and I'm going to do all this stuff to you. And I've always seen, and that's why I love what you said before, that we're so alike, and really attracted me to everything that you always talk about. I'm always concerned about some of the culture of medicine where we don't see ourselves as the humans taking care of another human. And yes, we happen to have been blessed and gone down the right tool. Some of it is serendipity. A lot of it is just a lot of hard work and just being interested in that field and whatnot. But we are so blessed to be able to learn these techniques and these technologies to bring to patients, but bringing it in a human to human standpoint. And can you talk about how important it is as a neurosurgeon and how much it has basically made you such a person to be sought after to do their surgery? Because I know patients seek you out for that very reason. It's because you understand their needs from your own perspective of understanding what it's like to be injured as an athlete and things like that. How important is it for younger physicians to understand we are not our professions? We are humans that can become excellent at doing our professions, but we are not that thing. That doesn't define our who and our why.
No, thank you. That is exactly the correct expression of what I was trying to say. It's when I'm in clinic, and as I've matured, it's become much better organized and a lot more confident and a lot more authentic, because I understood better how to communicate unapologetically. We're kind of brought up in this prescribed way of how we're supposed to communicate, and the master servant paradox sort of ideal of, who's in charge. And the older I get, the more it's backwards. I'm the servant to my community, and I've got a big community, thank God. But the authenticity that I think I bring these days has accelerated and made more exponential the size and depth and intimacy of my community. And I really see it as this community of like-minded people with high-level goal structures and big aspirations. And I take care of 75-year-olds who still don't know who they want to be when they grow up. That's a thing. That it's a mindset. It's an attitude. It's a swagger, and that's why I do spine surgery, because it has the opportunity to be incredibly optimistic, and yet, when I came into it, it wasn't optimistic. It was the opposite of that. And so it was really easy to find a compass heading and be like, let's make this more optimistic. And so what does that do for you when you suddenly are talking about people's goals instead of people's disabilities? And it changes the entire scope of the conversation. And so to young surgeons, there's way too much emphasis on looking at an MRI and defining the target for theoretical application of surgery. That's not our job. Our job is to find out, okay, when did your spine health crisis start? What was the provocateur? God knows you were at a certain position. Your spine was 95% the same until when? Our goal isn't to take them back to teenage years. Our goal is to take them back to pre-crisis. And what's the least invasive, most holistic, most recoverable application that can get us back to total functionality at their standard level, and then maybe use that crisis as an opportunity to ascend to an even better level. And I'll do my own example. I herniated a disc pretty properly, and when I was 49, and I had pain for a couple of years. I didn't want surgery. I was still working out. I was running. I was prehabbing just in case. I actually, when I got hurt, truth to power, I committed to my fitness harder. I didn't abandon ship. And, no matter what, I had to validate the need for theoretical intervention. And, it turns out, despite staying in great shape and being more committed and building habits and focusing better on nutrition and drinking less and not showing up for my games as though it was fitness, which is the exact mistake that every mid-level adult seems to make. 20 and we train our butts off for our sport, and we're 45, we're too fancy, we don't have enough time, so we show up for games, think we're 20, and we get hurt. Well, by the time my hand started falling apart on my dominant right hand as a microneurosurgeon, it was like, okay, I need surgery, and that was like 3 days later. But I entered that episode completely in shape. So the point I'm trying to make, the MRI, I knew I had a herniated disc. That wasn't the decision point for surgery. The decision point was failure to thrive and failure to be me and failure to see a pathway where I was going to be the me I always envisioned me to be. And that's the conversation, I think, that really creates one, clarity as to actual choices in how we make spine surgery decisions. But more importantly, it gives ownership to our patients. So when I tell somebody, look, I was you, and this is how I handled it, they immediately identify. And I think being relatable is so super important to build trust and intimacy and conversation. And there's too little of that in white coat syndrome, institutional, historic healthcare. And it's okay that it's traditional. I'm not anti-traditional. I'm incredibly traditional in a lot of beliefs and respects and things like that. But on the other hand, those boundaries are a problem, especially when the doc doesn't portray a healthy lifestyle, or doesn't exude a healthy mindset, or doesn't represent himself as a kind, empathetic human being. I mean, there are a lot of doctors out there leading with position and not with authenticity. And so to the next generation, look, build yourself so you can set the tone, set the example, set the conversation, because people are going to trust you and believe you if you're leading by example. And it's just, parenting 101. I mean, we're in a position where we are literally a confidant to people. In this case, a professional confidant. And, I think it's really important that we set the bar with, following our own advice and not just being a hypocrite up there with all these, brilliant technological recommendations that have no basis in reality.
That's a great answer. And I would encourage anybody that is just thinking about getting into any type of healthcare field, especially young surgeons, but anybody who's thinking about entering medical school or doing anything, go back and watch this little clip that Dr. Masson just beautifully stated, and then watch it about 6 more times and really take that to heart. I will tell you, so great things you brought up. Servant leadership, 100%. It is something that is catching on in the business world. It's catching on everywhere. And I think it needs to catch on way, way more, because we really, again, as human beings that are taking care of other human beings, we're really a servant to the people. And we really have to figure out what are their goals and dreams? What are they trying to get back to? And how can we make their lives get at least back to kind of pre-crisis state, but also just try to offer the best things at the right time with the right procedural mindset. But again, we have to take into consideration everything about them. And in my practice, where I do a lot of adult reconstructive surgery on what sometimes are not metabolically healthy people, I've really made it a passion to overall look at the patients as far as their entire health and wellness structure, because it's so important in their outcomes. So not only their physical health and wellness, whether they smoke, obesity factors, their diabetic control, all types of other issues, what their current diet is, microbiome health, but also mental health issues. Because in a lot of my patient population, where we're operating on people who have suffered decades with their stuff, or they're on their 8th back surgery and coming from another state to have their surgery, mental health is such an important determinant into how they're going to eventually, do after surgery. And if you're not optimizing these patients, and oftentimes you're right, we're just thinking about, oh, we're going to do this beautiful, surgery. In my case, it might be, it might be minimally invasive. I do a lot of minimally invasive myself, but it might be a T10 to the pelvis. If that patient is not optimized, you can make the x-ray so beautiful that your colleagues look at it. Wow, look at that reconstruction. You got that scoli from 53 to 11. That is meaningless if that human being has not had restoration of their life. It literally has no meaning. Our role is as healers to make people better. So you've already have me inspired. We're just a few minutes in here, and that's really good. Now I want to ask you, I know that this is something that I know it's going to be a pet peeve of yours without even asking the question. I see so many people that, let's just call them the 40 plus year old crowd. Okay. They have gotten themselves, they not only do they have spine, obviously they're seeing me because they have some spine thing going on, but they also, a lot of them are in a metabolic crisis of whatever sort, even if they don't know it. Okay. Most people are not metabolically healthy. That is one of my big passions in the whole wellness thing. One of my pet peeves is, and I want to ask you how you handle that patient, is the patients that come in and have all these issues, and clearly they are in the completely wrong mindset. They've completely given up, and they think that when you turn 50 years old or 60 years old, or sometimes even 42 years old, literally your life is over. You're an old person, and this is how old age is going to be. How do you handle, I know you could tell me your frustrations on that, but how do you handle that person that's like, it's over. This is just how it is. All my friends are like this. Everybody's obese. Everyone can't, is non-functional. Everyone has poor marriages and difficulty with their children. How do you handle that?
It's a really important question. I still try. And even though I have this fancy high performance messaging platform as a practice, the most meaningful piece of my practice is taking people that have lost that, but still have that aspiration or goal somewhere deep inside. And so to your question, I try to reel in those dreams and those hopes and those identities somehow. And you clearly fail sometimes. And honestly, when I do fail, I consider those people almost hopeless. So unless it's a mission critical, you need this or else you're going to be devastated situation, I try to steer them away from surgery, because in general, I don't think they're going to do very well. It's not like I have these delusions that someone's going to suddenly become more active for back pain. That's that's complicated by all of the usual suspects as far as risk factors. I mean, of course you have back pain. Why wouldn't you have back pain? I mean, it's absurd. Surgery's not going to fix that. So that's a group that I really try to get out of the surgical lane, if you. On the other hand, when you can take someone out of the droning machine of societal ageism and expectations, and you can restore, what do you like to do? What are your goals? Who do you want to be? I mean, do you have kids? How close are you with your kids? I mean, I usually will literally take them down this rabbit hole of personal life and see what inspires them. And if I can find a hook of inspiration, I try. And usually you find something like, man, I really lifelong I've wanted to learn how to fly. Or you know what? I love to fish. Can you? Hell no. So you're giving that up? You don't even want to fight for that? Really? Why? Why wouldn't you want to fight for that? Well, I can't, my back. Well, I thought you said you were too old. You weren't, it's a conversation. And before you know it, well, what if you could get yourself significantly leaner, improve your nutrition, improve your rest recovery cycle, build habits that are positive to your lifestyle, and then you find out through those habit build that you've got one piece of your macro that's holding you back. And in this case, maybe it's spine. Well, maybe if we do a little something, whether it's reconstructive or decompressive, maybe that piece is subtracted. And now you're still focusing on all the positive things you can do to become that person again. I went through that at 49. I had a moment where I actually felt the whispers of everyone always said, Robert, when you turn 50, you're not going to be able to be yourself anymore. Well, I can proudly say after a shattered clavicle at 47, an artificial disc at 49, a knee meniscectomy at 52. At 60, I run 6 days a week. I play full court basketball. I play tennis. I ski double black. I am in the best shape of my life, barring, high level obsession in my 20s. I hold nothing back. I remember those whispers. And I was like, that's just nonsense. That's just noise. And so I still try to recruit people out of ageism. There are all these historic, we used to, as a population 300 years ago, we didn't live past 50, and needless to say now. So we need to be at the front of these changes, not at the back of these changes in healthcare, right? Because healthcare is the delivery of health, and we're the naysayers of doom in most cases. I know you post about a book about the uncaring of healthcare. I forgot what the title of the book was.
It's Uncaring by Dr. Robert Pearl, and it's how American healthcare is killing both patients and doctors. It was a little talk to him on a show. People will see that's going to come right before this show is published. Cool. There's absolutely truth to all of that stuff.
So anyway, I try to grab something down deep and use it as their compass heading and put that out there and say, okay, if you fall 10% short of your destination, you're way better than you would have been not trying. But, let's embark on this journey. And if you're committed, I'm committed. If you're not, get out of the surgery lane. It's just not going to help.
Yeah, I think you're sparking so many kind of thoughts and ideas. You're absolutely right. Again, going back to kind of young surgeons and how we can try to shape them and think about kind of how we thought about things. Because I mean, I've morphed over my practice. I am such a different person than I was 18 years ago. I mean, I still have the same personality, but the thoughts and the way I approach patients and who I choose to operate on has changed just so dramatically based on all these other factors like you talk about. And often we do end up being sort of a, quasi-therapist for our patients, trying to really help them along the journey. And again, that's where we put our humanistic hat on and say, how can we just, like, I ask patients a lot, how can I help you? Like, honestly, like, how can I really, really help you? What are you even looking for? Right? Because spine surgery, it can help that problem. It can help their sciatica or sometimes their back pain or neck pain or arm pain or like stuff you had, but it's not going to fix their entire life. They have so many more problems. And honestly, I spend more than half of my visits, talking about anything but spine surgery and everything, how we can change their lifestyle. Getting into, I do a lot of obesity stuff now. I did just do all these things that I was not doing, even 5-6 years ago, because it's just the stuff that we do in well-controlled, hand-picked patients can be amazing. It's just amazing. I mean, I'm sure I could ask you, give me your top 100 patients, and you can go on and on about all these patient miracles that you've had. But you know what? If you were choosing some of the patients that come in and have horrible mindsets. They opioid dependent, just have never taken care of themselves and expect Dr. Masson to fix their entire life with this microdiscectomy.
Right.
That's ridiculous. It's ridiculous. And I'm more and more open about it. I say, listen, you have a list of 100 problems. We're just going to fix one. We got to work on the other 99 percent of problems. And we cannot emphasize this more to the younger, crowd, that the faster they can get to these ideas and these understandings, the better. And the last thing I'll say before we really dive into, surgery is this: aging is a process. It's not a disease, people. It's not a disease.
Yeah.
I have patients, they're in their 80s and they are so excited about every single day of their life. I just want to bottle their energy and then sell it to the next crowd or just give it away or whatever, because it's just, I'm inspired. I walk out of those rooms and I'm happy. And I'm like, what if I'm like that and when I'm 87 years old, it's going to be incredible. And some of those patients with minimally invasive surgery actually can do really, really well, right? A sciatica 1-level depression is incredible for some of those people.
Yeah, I'm going to throw a shout out to Mr. Tony Handler, who's in his mid 80s, and in his 70s, he did 7 Ironman triathlons. He's got another half Ironman coming up at 85. He had spine surgery. He and I met in the OR, but it was, again, a small step and a big journey. And he's about as committed as anybody. I have a lot of people like that who just defy logic in terms of their ability despite their age. So, but age. You're old when you give up. You're old when you don't commit to habits. You're old when you don't have goals. You're old when your dreams have faded. You're old when your perspective of life and joy and optimism has faded. That's death of your existential life. There's your physical life end, but the existential life end is super, super important to youth. And I'm still a child. I still don't know who I want to be when I grow up, as we'll talk about later.
I absolutely agree with you. It's funny because, and we talked about this when we first met, and that I'm 50 and I've been blessed, and I've had this amazing spine practice. I run our spine practice and things like that. But now I've put on this other hat of the podcast and building these wellness centers and being this maniac. I mean, I literally will pull people off the street and try to give them kind of pointers and advice and just things I've learned, or just pick their brain, because I learn every day from talking to experts like you. Is just learning. I have never been in a place where I am more inspired to do more for the world than I am now. And I could do this 24 hours a day. That little thing called sleep gets in the way. And again, I preach sleep, so I got to get some sleep. Yeah. But yet I've never been more energized. And talking to people like you, I mean, I don't know if I can match your energy level, but I'm really trying. But just, it's so energizing to do what you love and be passionate about it. And honestly, that's what keeps you young. But not only that, just going back to what you said before, kind of living the lifestyle. We're not here, and my style, I'm very casual, kind of like yourself. I'm not trying to lecture anybody or saying, oh my God, you're living this horrible lifestyle. But what I am doing is trying to live the lifestyle myself. I'm a big biohacker. I'm big into the, red light therapy and all this other stuff. I do laser treatments and also the exercise and intermittent fast and microbiome stuff. And I love it. I love talking about it, but I'm not talking about it because I'm trying to lecture anybody. I'm talking about it because if you live that lifestyle, if you make those changes, if you see what the, latest advancements are, there's so much science now on these things, even mindfulness science and changing nutrition to improve PTSD and depression. There's so much hard science from the best institutions in the world. People just need to take note. So I did a post the other day. It was one of my favorite, posts. And it was, I had a day in clinic, and it was a hard day for me because I saw sick patient after sick patient. And it was, honestly, after a while, I kept coming out and talking to my staff, and I'm like, I'm just devastated. It was the opposite. It was energy sapping, because all I talked to them was about their health and getting them better. And I did a post, and the only thing I could think of while staring at these folks was, if I could just go in a time machine, take them back 20 years, and then show them a movie of the person that I'm talking to and looking at, what they're saying, what they look like, what their health is like, and whatever, would they then finally make the changes that are necessary and live that different lifestyle. And again, for some of them, honestly, it's just walking down the block a couple times and maybe not having that, 7 extra meal, whatever it is. I mean, there's just very simple things that people can do to change their lives. And if you don't do those things and you accumulate it over the months, years, decades, how can you be? It doesn't make sense. It's unless you have the best genetic makeup on earth, nobody can withstand that. You just can't do that. And then just the final thing, and I want to really dive into, minimally invasive, as you've been a tremendous pioneer on the field, is that I really want to emphasize to guys out there how we need to really, even though we are super specialized, think about what you do. You do super specialty, minimally invasive surgery, but yet you are so holistic. And we have even talked about, I'm now part of this Society for Brain Mapping. We've even talked about, potentially down the road at some point doing a non-operative, non-invasive fellowship for guys that are in spine to learn all the other things that we can offer people that are not not medication and not invasive based, that can help them, because our society just really needs it. And I'm going to scream till I'm just blue in the face, which is hard. We've got plenty of melanin in my skin. So if I turn blue, that means that I really mean it. I really mean it. So on that note, you've been a pioneer in minimally invasive surgery. You've trained personally, so many surgeons throughout the world in minimally invasive techniques. In just a kind of a 10,000 foot overview, why has minimally invasive surgery made such a dramatic difference in recovery and getting patients back to health so much faster compared to some of the traditional techniques we were doing for even things like unilateral decompression surgery? What's the difference, and where is it most valuable? Is it, more valuable in decompressions, or has it made a more dramatic change, for example, like a minimally invasive?
That's an important question, because people tend to think, oh, well, it's highlighted in decompression. So it was always about the why again. I'm always going to come back to the why, especially on these laser focused rabbit hole questions about a technique. The goal is rapid recovery, functional restoration of lifestyle. So with that as the target, that is the compass heading. It was easy in the mid 90s to look at athletes. So when I have somebody who's the opposite of an athlete, what is my expectation for their functional recovery after any kind of surgery? Then you have an athlete. Oh, well, they're going to do better. Oh, why? Because they're genetically gifted? No, not really. I know a lot of great athletes that have an unbelievable commitment and discipline and habit structure. And habit structure is so much more important. You can have a naturally gifted athlete. One of the biggest, as a young athlete, biggest crimes you could commit as a genetically blessed human was to not optimize your habits and your discipline. And you showed up for games based on your gift, but you sacrificed the gift. You wasted your gift. And to me, that was criminal, because I had to earn it the old fashioned way. It wasn't natural. And so you start with that. Athletes do better. Why? Because they're healthy, their habits, their discipline, everything else. So, okay, well, if we're doing surgery, whether it's a decompression or reconstruction, and we're causing trauma, we're adding X amount of trauma to X amount of recovery. We're depleting the net recovery. So is it intuitive that if we can reduce the trauma of executing the actual objective, are they going to do better? Are they going to do better faster? Are they going to get back to life at a higher probability? Well, of course. Intuitively, the hypothesis is easy to project. It's a no-brainer. So is there value in pushing the limit of max objective, least trauma? And the key is not gimmicky MIS, meaning you still have an objective you have to accommodate to get best recovery. But so it was very easy, and in those days, Albert Roden was my chairman. He's the father of modern microneurosurgical anatomy of the brain. I was a skull-based cerebrovascular fellow. So in my mind, as someone who is really more of an ortho mindset, but heavily involved in deepest level brain surgery, I was doing brain surgery at this level, and I was doing spine surgery at this level, despite a great, fertile, one of the best academic programs in the world at the time in the 90s at UF with Rick Fessler and Art Day and Al Roden and more. But again, brain here, spine here. So what if we took spine to brain? Are we going to have a landscape for a better functional recovery? Of course we are. A rodent thing was take bone, not brain. Don't pull on the brain, drill the bone down a little bit. Something as simple as that in a TLIF. What have I done in IMAS? I'm much more careful about inferomedial bone work in the foramen so that every tool doesn't get forced up towards the nerve root and, needless to say, the thecal sac. And I don't do any nerve retraction. I don't touch the nerve. I don't see the nerve when I do my TLIF. And that is a concept that people are like, you what? And it's like, well, why would I? I'm trying to go everywhere but the nerve. I race cars when I'm not looking at the wall when I go through a hairpin at a speed that the car doesn't want to stay on track. I'm looking at the exit point because that your body goes where your eyes take you. And so when you're doing spine surgery and you're ultra precise, you're dealing with nanosurgery kind of mindset, and your goal is functional recovery, your compass heading is different than when you are starting bleeding as you go. Like, people think I'm nuts these days. As an older guy who does MIS, my reconstructions are 18 millimeters, which is bigger than it was 15 years ago when it was 16, 14 millimeters, but we had wound problems. But when I do these on a TLIF, what I'm really trying to do is minimize trauma. So these days, I do my approach under the microscope, the skin, the muscle, the fat, everything. I'm ahead of bleeding. I don't bleed at all the way down. So there is no ooze after the fact. It's dry in. And so early accuracy is such a big evolution of my own MIS capabilities. Like, I started out thinking, it's just about the size and the approach and muscle splitting versus muscle cutting and ablative muscle management, and retractor management is a thing, and unilateral versus bilateral retractors, and sustained retractors are in and out. And there are all these little technical details. But at the end of it all, early accuracy, minimal trauma early is the biggest of all. And that's the last thing I brought to my table. And so I get through a case and nothing's bleeding. Minimize hemostatic agents, a couple of pieces of gel foam. You were easy in. You coagulated an epidural vein as you were there, as you were staring at it before you ripped it to shreds. Why rip it if you can cauterize it before you rip it? Just every piece of my cases these days is early accuracy, early atraumatic. And I invest so much more on the front end, and then I'm running downhill on the back end. And, and so that plays into minimally invasive, but it's minimally invasive, least invasive is really what I call it, atraumatic. I've always called this project the evolution of the non-deconstructive reconstruction. IMAS was the evolution of the non-deconstructive reconstruction. The more you deconstruct, the math of healing and fusion rates and stability and adjacent level disease and just significantly changes. And if you're doing an ablative midline posterior column destructive procedure, you have no Golden Gate Bridge cables anymore. Why do we have adjacent level disease? I mean, that question alone, is it because of the fusion? Really? A clipple file doesn't have increased risk of adjacent level stuff. Maybe it's a way we do it, not the fact that it's fused. So if we preserve dorsal column, if we preserve the cable system from spinous process to spinous process, if we don't go out of our way to destabilize the middle column on both sides unless we have to, it's going to be more stable. The disc and the inner body graft, whether it's ALIF, TLIF, OLIF, XLIF, it doesn't matter. It's a more stable construct. It's bounded by soft tissues. It's bounded by ligaments and muscles and attachments and tendons. So the more preservation of the segmental architecture we can keep as a thought in a segmental reconstruction decompression, we can still be extremely max objective. But what does that take? And this goes way back to the front. The conversation in the office with the patient about details about the disablement symptoms. Like, if you know that if not for that symptom, they're fine, why do all that other stuff? But if you're just treating the level in the MRI, you're tempted to go after every rabbit hole in the MRI. I don't do that. You already know you're getting an indirect decompression with the inner body. So now you add max targeting at a precision level, you're done. Get the hell out of there. Don't go out of your way to impart trauma on somebody in a zone where they have no symptoms, unless you're causing symptoms. So it's just both clinically and surgically, it's much more precise, much more thoughtful. And that, to me, is the value of minimally invasive surgery. It's still maximally objective. It's just, why perform trauma? trauma is going to slow recovery. Trauma is going to impede theoretical max performance. If I rip your hamstring to shreds versus I don't, I just stretch it a little, are you likely to have normal hamstring function lifelong? Probably not if you rip it to shreds. Same paraspinous muscles. Are you going to have perpetual chronic low back pain if you devastate the muscular structure of the lumbosacral spine? Probably you're going to have a lot of back pain for the rest of your life. Well, how about we don't? It's just, do we need data to validate that? And that's what drives me nuts is, the data, the implicit bias of the data. But I'm going to spare you that.
That was great. We want to make sure that a lot of our lay audience, a lot of care workers, nurses, and all kinds of other people watch this. So we could get into deep, deep nuance on minimally invasive TLIF, which is a go-to for me. I love that surgery, especially, right? You decompress the side that is the maximum thing, but you get the contralateral foraminal decompression without having to rip everything to shreds, like you said. And it's beautiful. I mean, the studies, you look at the studies, I know you know all this stuff, but just for our audience, if you look at those MRI studies, one year later, a lot of them show there's almost no muscle damage at all. It's just clean. You just see, you'll just see hardware there, and there's nothing. And that was one of the things that drew me to minimally invasive surgery, which thankfully, when I trained at the Leatherman Spine Institute, Mladen Jurazovic was a younger guy there at the time. And he went to my alma mater as well, Columbia. Before that, I kind of took the same path, came behind him. He was doing minimally invasive. He was one of the first guys that was doing it in that practice. There was another guy there that was also doing minimally invasive at a different practice in Louisville, same hospital. But I am so thankful that I had an early look at minimally invasive, because in those days, when I came out in 2007, still many people were not doing it. They were refused to do it. They just would not do it, as opposed to today's fellows where it's a lot more commonplace. Most people are having at least some exposure to minimally invasive techniques, which could make a big deal. So what I was going to say is, just in general, in minimally invasive, you talked about your kind of epiphany where you said the brain was here and the spine was here. It's interesting. As an orthopedic surgeon, I remember having this epiphany very early in my career, as I was saying, like, what do I need to personally kind of get better at? Just generally minimizing kind of trauma. And I would watch these guys, some of my colleagues that are hand surgeons, and they're doing, 11 carpal tunnels in one day and then some other thing. And I just said to myself, why do we do things so choppy in spine surgery? Why do these things take so long? Is it the steps? Is it the bleeding? What is it? So I just remember one day turning to my PA, Jacob, and just saying, why can't we run our days like the hand surgeons run their days, and even run 3 rooms in a day if we're so efficient and getting in and out with minimal blood loss and going on to the next, and really looking at it that way? Think about the minimization of trauma on these patients. They're in surgery for, 42 minutes, literally the entire anesthesia, to have some of these decompression surgeries. It makes a massive difference. And so one of the things that I like to talk about a lot, and again, I do a lot of big reconstructions just because that's my practice, but I really, on the other patients, I always try to focus on doing things minimally invasive. And so the length of time, obviously in minimally invasive surgery, once you become proficient at it, can be a lot less. But even in maximally,
can I add something?
Yeah, absolutely, please.
While you're saying the major reconstruction, I want to emphasize it's not about the skin size. Sometimes I don't do a good enough job emphasizing that that's not the detail. It's how you handle the tissue and major decisions about ablative steps. So you've already established yourself as a least traumatic surgeon, which is really more important than minimally invasive, honestly, as a moniker.
I understand. I'm a big proponent of minimally invasive surgery and motion preservation. You had the total disc replacement and that stuff. But I think that honing our skills and really learning from people that know how to do these things. Like, for example, if you're doing a big scoliosis reconstruction, okay, and you're still doing it open, I mean, some of them can be done minimally invasive for sure. But if you're doing it in an open fashion, there is a huge difference. I talk about this a lot, between having a 4-hour or a 3-hour procedure, right? And you're doing all the objectives that you need, and having a 12 and a half hour procedure. I cannot
Monday.
stress. It's so dramatic. It's hard to, I mean, you're talking about ICU stays, blood loss, all these other things that we preach about constantly. And so at some point, I just made the decision in my own practice that I am going to make myself the most efficient that I can be, the safest, but always at least attempt to get all our goals, make sure this nerve's decompressed, this contralateral nerve, all those things. A lot of it is preoperative planning, but there's such a big difference. And one of the things I wanted to bring up is prolonged duration of surgeries and brain function.
Mm-hmm.
And so that's something one of my previous partners, who actually is one of my partners now in the wellness field, Dr. Dan Sipple, he's a physical medicine rehabilitation specialist, also a genius. And way back in the day, the way I earned his care is at that time, I was emphasizing so much minimally invasive, or if you're going to do these other surgeries, being able to get through them in a time that's not a danger for the patient. And he started referring me all of his patients. And then we became friends that way because he was sending me stuff. The outcomes were good. And we kind of built a relationship that way. But his main function is he always preached to his patient when he was referring and things like that. He's like, I'm going to refer you somewhere where we're not going to affect your cognitive function so negatively, because if you have these foreverotomies, as we like to call them as surgeons, we all use that. It's inside baseball. Okay. Foreverotomy is when the surgery takes forever. So just so that so that the lay people understand. But when you're doing these foreverotomies, nothing good happens. Listen, if you're separating conjoined twins, it's going to be a foreverotomy. That's a different thing. If you are, doing a heart transplant, right? There's only so much you can do to make that, go faster. There's a lot of ways to make it go faster, but whatever, that's outside my scope. But doing these very, very long extended procedures, forget the procedure. Again, it could look perfect clinically, right? There's clear documentation that your complication risk increases significantly with every 30 minutes that the surgery goes on after a couple of hours.
Absolutely.
Period. That's crystal clear. People can Google it if they're, if they're interested in kind of the data on that. I'm curious to ask you, is that something that also kind of you thought about early in your practice, the cognitive decline, especially in some of our older patients? I mean, we've got to be extraordinarily careful with because some of that cognitive decline, it's most pronounced in the first month, but sometimes it can be permanent. And so being in surgery forever is never a great idea for these elderly patients.
No, there's no question. So one thing, hearing me, you probably sense that, wow, I back out to macro, but then I dive into little tiny holes. But every piece of the 360 degree of care to me is a pinch point and an opportunity for optimization, because I'm basically significantly OCD and I just need to finish. I need to perpetually optimize every piece of it. And when we get into eXeX, you're going to see the nth degree of that. But the cognitive decline. And again, I've had 7 concussions in my life. And so privately, I'm worried about that. So CTE and all the things that people worry about. But, anesthetic time, relative ischemia, drops in blood pressure, the increased need for extensive medication, all of these things have their own chemical and biological effect on brain functionality. And why do we know that? We know it most because of our older clientele. It's everybody knows that the sundowning rate in traditional spine surgery and in older patients is high. And there's a lot of cognitive decline that's front and center. And every resident, every young spine surgeon has seen that 1,000 times. But it's not as obvious in younger people, but it's there. And it's a life event that's going to carry with them. But so to your point, I have seen that my whole career, and I have always felt the burden of optimizing that. And that is not only my own procedural capabilities, but my obsession with anesthesia, like how I communicate with anesthesia, who I let be my anesthesia. Do they know my times? Do they know that I'm plus minus 5 minutes? Are they giving anesthetic to accommodate a predictive plus minus 5 minutes? Or did they just load them up for a 6-hour because they didn't care, nobody communicated, and blah, blah, blah? It's on me to make sure everybody knows my expectations. I will be here for this amount of time plus minus 5. That became a thing probably 20 years ago. And then it's like case to case to case. Recovery room. You walk in and wow, we have pain scores. Nurses, poor nurses, they've got to do all these things now. And it's a checklist. Oh, we've got to get a pain score. So you see some poor patient sound asleep, and then the nurse waking them up out of a deep coma to ask what their pain level is. By the time they're awake, they're so disoriented. It's a 10, it's a 10, it's a 10. What do? Give them Dilaudid. You woke up a near comatose human pharmacologically to ask a pain score so you can give them more Dilaudid. Genius. Wow, that's healthcare. That's our standard. Healthcare. That's actually best practice. I was like, it's ridiculous. And so communication with perioperative staff and preoperative staff and medication management. Is this person coming on 5 years of opioid dependency? If so, then what? Well, their anesthetic load is going to be a hell of a lot more because they're chewing it up like candy. Well, there are things you can do for that, which makes speed of surgery even more important. And that person's at a much higher risk of cognitive decline, and they're going to need a shit ton more of opioids post-op to keep them relatively on pain control. Unless it's a least invasive procedure, which is a lot less painful than a max invasive procedure unnecessarily, unless it was so. So every piece of the puzzle, to my point, and I'll stop ranting now, is really aimed to optimize that too, brain performance post-operatively in a way that we're not setting that human back for the rest of their lives unnecessarily. And it's not recognized. You talk about it often and brilliantly. Too many young surgeons don't even consider it. When I've mentioned it over the years, it's like I have three heads. I mean, literally. Like, what language are you speaking? It's not familiar at all. It's not being taught academically at all. Big time academic spine surgeons are focused on the technical detail of surgery, and that's it. There's no holistic approach being brought into our young residents, young fellows, young trainings, and it needs to change. And I'm actually really confident because this new generation, the one right after you, is probably the most organically wired that way of any of the generations. My generation kind of dropped the ball. Before that, none of this was even thought about. In my generation, it became all about the surgery. It was just, let's crank out surgery. And, but I think we're coming full circle. I think the pendulum's about to swing towards a very holistic application of healthcare.
Right. I mean, I really appreciate that answer. The first thing I'll say is the three heads comment. I use that kind of all the time, or just I always say they look at me like I'm speaking a different language on some of the things like cognitive decline after surgery, this and that stuff. When I talk about it to fellow surgeons, they're open to that. They get it. They're trying to be better, especially the younger ones. You said they're very open to it because they think about things like that somewhat more. When I talk about my wellness and holistic practices that I've now incorporated into my own practice and try to get fellow surgeons, doctors, infectious disease, all these guys that I'm around, it is like they don't even know like where my basis is. But what do you mean? I don't understand. Like it's actually funny. Meanwhile, I spoke to a group of progressive physical therapists yesterday. They didn't know the technologies that I was talking to them about, all these biohacks, but they could not.
I mean,
they got the science, but the amount of intrigue and interest, and immediately, oh my God, I want to refer all these people to you that are struggling right away. I do the same thing to physicians. They're like, what do you mean laser therapy? I don't understand. What is a laser going to do? Take off a mole? What do you mean? And then I try to explain to them the science, and the reaction is, it doesn't do anything. Well, have you read one thing about it? No, but I'm pretty sure it doesn't do anything. Okay.
No, from my perspective as an outsider looking in, I'm the old guy. And so I was going into these tiny holes that people didn't appreciate. Well, my tiny hole is a massive hole to where you're going. You're going to the cellular level and to the chemical level, and I wasn't the anatomical level. And there's a perpetual optimization opportunity, and I'll leave it at that. So no, kudos. I think that's incredibly important to us further establishing maximum health. So it all comes full circle to the why always.
All, and I think,
always.
we're going to get into eXeX in a minute, but, with the advent of AI and all these technologies, man, when we tie this stuff all together and are able to do, kind of continuous monitoring, people can use AI to plug in all the stuff they're doing. We as physicians can see, kind of what their biometric markers are doing, and then make decisions together with educated patients through AI. It's going to change everything. And I'm
Right.
excited that there are, a lot of physicians now stepping up and becoming, leaders in these spaces, like yourself in eXeX, like Dr. Pearl, who is leading the way, with his new book, ChatGPT MD, and all these guys. I mean, you guys are really setting the stage for an absolute revolution in healthcare. And we need to do things different. And Pearl calls it healthcare 4.0. And that's what eXeX,
Yeah.
healthcare 4.0. It's
Yeah.
the next
Yeah.
iteration. So before I close out, just a couple quick things. I love your obsessive compulsive, like you say, on these things, because there's no other way to optimize their care than to be obsessed. My kids ask me, why am I obsessed about everything? Because I said, well, there's no other way to become excellent at anything. If you're not obsessed, then you're just like,
Right.
we'll just do this. Oh, this guy
Yeah.
told me to do it this
Yeah.
way, or whatever.
Meh.
That is poor way of looking at stuff. No different than Kobe Bryant and his obsession becoming the greatest basketball player ever.
Mamba mentality. Absolutely.
Mamba
Yeah.
mentality, and you have that. You are the Mamba mentality, but the obsession. And again, what you said on the anesthetic front, people have to understand obsession. Like my time, I say this almost every case, same way every time. Like my ACDF, same way every time. I use the same instruments in the same order, put the pins in the same way. I get my X-ray this, and it's always, and it really is a plus minus 5 to 10 minutes. I don't know if I'm plus minus 5, but I'm definitely plus minus 10 on all my times. And one of the things that we always emphasize, and I talk to anesthesia a lot, you can get fluid overloaded from these little procedures. I mean, if they're giving him 3 liters of fluid for a surgery that I'm losing 5 cc's on, especially if they're older patients, not good. You're absolutely right, looking at their opioid status and how to do that. We have to be like really precise on how we dose them before and after, and make sure. And again, the minimally invasive, sometimes they don't need to, in opioid naive, 2-3 days, maybe. You might not even need opioids at all.
Yeah.
Honestly, even for a back surgery, right? You take Tylenol and you're okay. And I have patients sometimes like with a little minimally invasive, like through the tube, little Lammy, they're just Tylenol and they're fine with that. And then all of those things for my patients that are going to be hospitalized, if you're not optimizing them in the surgical suite with all these little things, which seem like nothing, amount of fluid they get, this and that, and whether or not they have a Foley in, all these little things add up to length of stay, right? And what happens in length of stay? The longer they're in their hospital, nothing good happens in the hospital. We've got to get these folks out of the hospital. The ones, when you were doing, bigger, but when you were at these big centers and doing great work, once they start lingering, you start to your mind, you're like, oh boy. And once they end up in the ICU, it ain't good. Nothing good happens in the ICU. Every ICU doctor tells you, don't get them here. You don't want them in the ICU. And again, that's the difference between a 4-hour scoliosis reconstruction and a 12.5-hour scoliosis reconstruction. Is the 12.5-hour case, good luck not getting them to the ICU. It's just not, they're a mess. They're a mess.
Passive blood loss alone is enough that you can't get past that.
They're a mess. So
you got your typing cross bloods, the cell saver.
So anyway, great stuff so far. Now let's get into, we'll call it your baby. And I'm a huge fan of eXeX because I am obsessed with efficiency in the OR. And American medicine, American healthcare is so inefficient. It's people that are listening to this, the ones that are in healthcare are crystal clear on how inefficient it is. The ones that are not in healthcare, I think if we really had a 2-hour discussion on inefficiencies in healthcare, it might be jaw-dropping because it's one of the most inefficient systems imaginable. Hospitals need to get dramatically more efficient. The level of waste. We can't even overemphasize it. It's not possible because it's that bad. And so tell us about how this vision kind of came to you for eXeX, what it is and how it's going to change American medicine and world. I should say world medicine. It's a world thing. I don't want to be American centric in any shape or form here.
Well, I honestly, because we have focused this on wellness and healthcare and spine surgery, it gives me the most authentic answer to this question that I usually get from the eXeX hat. Usually it's all about the tech and the opportunities and the application of surgery. And the problem is surgical disorganization and all of the tentacles of what that means, surgical disorganization. But we just had this beautiful talk about pinch points and optimization of trauma and surgery, blood, fluids, chemicals, electrolytes, pharmaceuticals, prehab, post-hab, wellness. Well, eventually, the inward-looking obsessive who's constantly trying to improve every piece of the puzzle realizes, oh my God, I can't improve anything inward anymore. What's next? The one thing I'm most guilty about, it's almost like survivor guilt. It's like I've built procedures and products for doctors for 30 years. What about the team? What about everybody else on the field? And we all kind of grow up with these quotes, you're as good as your weakest link. Well, is it a shocker that our scrub technicians and our surgical scrub nurses and circulating nurses are just completely frustrated and anxious and unhappy in most cases, and we're unhappy. And people in real world don't understand how chaotic healthcare in the operating room can be. And you need what? I need the same damn thing I need every moment at this time, at this sequence, at this point. I mean, I do how many of these a month? Are you kidding me? But that's quote unquote mediocrity, the standard of care. Standard of care means one thing, 50th percentile. What does 50th percentile mean? Average. Average is mediocrity by definition. So, we can do better than average. That's always been the guiding light. So bottom line is let's focus on the team. So what does that mean? Well, okay, now let's go backwards. Let's go to the foundation. Well, have we given teams tools to optimize organization, visual orientation, temporal organization, time? Do they know where they are in the case spatially? Do they know where they are in the case temporally? Are we at step 2? Are we at step 8? No, they don't know. They have no clue. They're guessing. And how many consumables do we need? I don't know. I don't want to get yelled at, so I'm going to open too many. Well, how many drapes? How many trays? Oh, well, where is that tool? I don't know which of these 7 trays it's in. So, okay, we'll open all 7. Okay. So what does that do? That affects sterile processing. So every piece of the surgical 360 degrees of care is riddled with 19th century methodology, memorization, guesswork, and just max delivery of every asset, every tool, every resource, every product, even implant systems. There's no effort to try to do predictive. I personally think at full form, eXeX will be able to help industry create small aliquots of deliverables that are patient-specific. What a concept. Patient-specific healthcare. Neat thought. Is that possible or practical? Probably not unless you think about it. Then it all of a sudden makes perfect sense. So eXeX was born out of this obsession, but this time we're focusing on raising the C. We're focusing on dead time. So if I can't safely, smartly, intelligently improve my speed, my time waste to get people out of the OR, what's the best way to get rid of time waste? Dead time, useless time, looking for stuff, not being prepared, not knowing what you're doing, not knowing who you are, where you are, why you are. That is like an F1. I love motorsports. That's a 12-second pit stop. Max Verstappen can't make up a 12-second pit stop. It doesn't matter how good you are as a surgeon. If your team is riddled with all of these stopgaps. Oh, where's the drill? Oh, we got to go downstairs and get it. Okay, well, I'm going to improve. What's the instinct? The instinct is to improve. What do you have? Because people like us, we're doing multiple surgeries a day. So you get an hour loss at hello on the first case of the day. It affects every subsequent case. The entire environment is already on edge. Everybody's anxious. Needless to say, we all are humans. People forget that sometimes. We have wives and kids and partners, and you got a sporting event or a dinner planned or God knows what. And I'm already late at case 1. And then case 2, something happens and it just snowballs and the day snowballs. And that's as good as it gets globally. period. And people
could not agree, chime in real quick. Could not agree everything you said. And we always say, how many times have we done this operation at this hospital? Oh, by the way, with this team. And it's not, and I agree with you, it's not their fault. They're not empowered. They're not doing the surgery. They don't know all the steps that we're doing. They're not obsessing all day about how we can maximize a TLIF. And anyway, I'll let you get into the nuts and bolts of how it works and how it's going to, revolutionize the game.
But that's the why. Since the theme here for this whole talk has been the why. That's the why. But so what was the solution? The solution was, expanded existence, eXeX, refers to the singularity of relative importance. Like, I think society actually recognizes that healthcare is tanking post-pandemic. And we've got to have some real fixes, not some Band-Aids. So that, and then we've got artificial intelligence creeping in. And then we've got, spatial computing and mixed reality and advanced computing systems and high-speed chips and access to all of this, all of the infrastructure necessary for predictive analytics and large language models and machine learning. So basically, we built an artificial intelligence enhanced surgical optimization software system that organizes every surgeon's every surgery relative to equipment pieces, orientation of room, OR specific with LiDAR scans of the OR. Where does every table go? Where does the Mayo stand go? Where does the microscope go? Where does the cell saver go? Where does the fluoroscope go? Everything exactly specific to every surgery, every surgeon. And with that, then, you go level 2. What trays do you need? Okay. What's a back table look like? What's the sequence of what the back table looks like? What's optimal organization for best performance? Mayo stand is the transition zone for most surgeries. It's at every phase of the case, the Mayo stand should look different. It should have different tools specific to that phase of the case. Usually it's just this mess. And it's like, they're not really sure where they are. So when we have our users, our high performing teams with eXeX, even if it's a scrub who's never known the system, it's like Google Maps for surgery. They see a holographic image of the Mayo stand and what comes next and what tool and what phase. And the reference guide talks about, okay, we're at phase 3. Okay, in phase 3, we need these things in this sequence. And every one, by the way, is timestamped and clicked off. Where? In this big imaginary Minority Report-esque holographic screen that the scrub tech can use. We're not putting mixed reality spatial computing devices on the surgeon in my product. We're 100% focused on surgical organization and team building. We want to empower the surgeon, superpower the team, basically. And we want everybody on the team to feel like they have a fighting chance of being absolutely brilliant in surgery, rather than always put in the awkward position of being the rate limiting step, when really industry and the medical industrial complex has done nothing to empower teams. And therein lies the guilt. It took this long to figure that out. Now it's loud and clear. It's absolute. And the affirmation we're getting from the world and from hospitals that we talk to, and all the big events we've got coming up, it's really going incredibly well. So it is so clear that the eXeX, expanded existence, that singularity is real. Everybody's ready for best of class surgical optimization. And that's what eXeX is about.
Absolutely. And it makes me think of, my choke points, because I feel like I'm always trying to get better. I'm always trying to get faster and safer and more efficient and all those things. But there is a point where you almost absolutely maximized. If I can shave off 2 more minutes, that'll make a difference. But really where the choke points are, like you talk about, are completely running around getting stuff. We talk about this obsessively. I wish I could kind of transfer my PA into this podcast real quick, because you'll say, I'm obsessed. I just say like little maneuvers. I'll just give you a quick example. When we bring the C-arm in to get a shot, I like to just use a cloth drape and throw it over it. That takes 1 second. Your thing comes in, you throw the cloth drape over. They have this obsession. I don't use it. They know how I like it, but like just putting this Mayo stand cover over it and like snugging it over. Just that is 15 seconds of extra stuff, and then you got to take it off. Right. So you start multiplying all these little steps over this beautiful dance of surgery, and that cuts into our flow state and how we're moving. Now, on top of that, for those people that really are not familiar with the way surgery works, a lot of times during surgery, we say, okay, we need this, we need like anti-hemostatic, or, okay, a drill fell on the floor, we need to get a new drill. And you're absolutely right. They're running around. We're doing it. Not to mention the Mayo stand. I would say I use about 20% of the instruments on my Mayo stand, and I do the same thing every single time.
Right.
I don't do a lot of experimenting at this point in my career. I use the same nerve probe. I use the same dural retractor. I use the same pins. It's the same, but yet they're opening up. And I just, it's funny. I'm going to post this on LinkedIn. I'm going to take a picture of how many trays, because people don't know this, how many trays are open sometimes for a simple spine surgery that's going to take 42 minutes. Right. And there's trays everywhere. It's just Trayville being able to, it's so frustrating.
And they don't have any way of optimizing it. Like if they knew what your 90th percentile tools were, they could actually organize those into the first 3 trays. And then you don't need 4 through 10. But what does that do to sterile processing? And is that sustainable? And does that bottleneck the OR at large? Does that slow down your transition to the next case? Does that make the case go? Like once we started using this, I have a pretty efficient environment. I honestly, because a lot of the surgeons who visit they can't believe how efficient we are. So we were kind of deluded to think, well, we might be doing pretty well. Well, the reality is my team recognizes that I'm actually taking my time. I'm actually doing the opposite of going fast. I'm actually slowing deliberately. There are braking zones and full throttle zones in surgery, it turns out. And when you're a master surgeon, you really understand which is which. And when you're in a brake zone, it's nice to be able to just calm and focus and slow. And I am in nirvana now, where there is no dead time. So I have all the time in the world. And boy, the emotional calm and focus, me versus me, it's the best version of me career long to have no distractions, ultimate focus, and a calm emotional state. And this implies that I was some crazy maniac when I was doing my 70, 80 cases a month reconstructive. No, we did it. We got it done. I mean, our x-rays were perfect, but the quality is so much better with flow state, inherent, nonverbal, team flow state, quiet execution of surgery in a relaxed environment. One curveball doesn't become 2, 3, and 4 because everything is just sedate and calm. And you're so ahead of yourself. In sports, everybody who follows major NBA, NFL, speed of the game. High school is one speed of the game. College the next. NFL pro, highest speed of the game. Elite level speed of the game. Well, guess what? Surgery is the same damn thing.
Yes.
Are we playing at a high school level, a college level, or an elite pro level? My speed of the game has never been faster than it is by enhancing our team. And at the end of the day, that's not rushing. That's effortless speed. That's mindful, present. Okay, read 1, read 2, read 3, read 4. Ball's gone in 1.7. Decision making is natural, intuitive, and immediate. Zero stress, zero anxiety. Are these things important in something like surgery? You would think so, right? If you're a special forces operator, are you going to want to do a close quarter drill at an incredibly chaotic speed of the game? Hell no. I mean, everybody knows this, but somehow in surgery, it's been neglected and glossed over. So here we are. We've got a plan.
Yeah, that's great. Flow state as surgeons is so important. It's actually 100. I could tell you unapologetically, the flow state of doing surgery is by far my favorite part of my job as a surgeon. Again, I just happen to be an orthopedic spine surgeon, but absolutely getting into that flow state, you're almost somewhere else. And it's just so beautiful. And the funny thing is, even though we are now able to get through these cases, even without eXeX yet, we're able to get through these cases in a very, very efficient manner. When I'm working and I'm in that flow state, and I always try to stay in that flow state. And if the flow state is broken with something missing or something like that, then I find a way to get myself back into flow state. Things are moving like they seem to be going so slow. Even if I'm doing a very complex case, next thing you look up, a couple hours have passed, but you just feel like you've been like in this like slow, very calm, relaxed process. And I do talk about that with younger people and people that want to be surgeons or young surgeons and things like that, about how important it is always no matter what happens, to be calm. And obviously eXeX helps, but when something goes wrong, when you're dealing with something, all of a sudden there's a major blood loss, or you're dealing with something is going on, even if it's an anesthetic thing or whatever, that's when that's when you have to be like completely serene. I mean, you have to find the way to slow your heart rate down to even lower than what it was before. You can't be the opposite way. And that's why, like, even last night I had a conversation with a visiting surgeon, and we were just talking about how important it is for calmness. I don't even know how we got into this discussion, but it was about calmness and how I see sometimes, and again, not even same specialty, because I'm on a lot of committees and I just hear things and things. There are people out there that it's the opposite. When things go wrong, they lose their calm. And then we're discussing what happened in the M&M sessions, because it's the opposite. Instead of slowing things down, they're speeding things up because it just feels like the world is ending.
Yeah, chaos.
You got to stop. And I always say, and I always use the typical example of, imagine if Captain Sully had decided to speed up instead of slow down. He was working at, like, that time period he was moving slow, and he was able to land in the Hudson River. And that's what we need to do as physicians, and always trying to get into that flow state it's just a beautiful thing. I know you appreciate, I mean, it's just amazing. I wish everybody could experience that flow state. A lot of people do in athletics and things that they do, but there's a lot of people that just don't get to experience these amazing flow states where it's just like you're just one with the operative field and the nerves and everything. It's beautiful. I love it. I love, that's why I get so excited about, like, especially surgery days where I have a lot of surgeries. I just want to make sure that I'm as calm in my 9th surgery as I am in my first surgery. And we get through days like that, and the level of satisfaction is hard to describe. Obviously, I can describe it to you there. So
I mean, where we used to feel it within cases, now we feel it within the week. We used to define it as, oh man, that was an amazing case. Now it's case to case to case to case, and the percentile of presence is so much higher. So it's just this ever evolving perpetuation of the ability to transcend into that effortless performance. And it's really, to me, defined as nonverbal, effortless physical communication. Everything is automatic. Everything is ahead of speed, ahead of time. There's no surprises. If there is a small surprise, it becomes a no drama event quickly because you're so ready for it. It's not common, too much bleeding to the point of coagulating early. If it's not bleeding and you have, it's so much easier to handle whatever you're confronted with. So just every piece of the puzzle, being ahead of the game, is super important. So anyway, wellness at the speed of light actually does apply to surgery. So there you go.
I appreciate, we love that title. I mean, we get a lot on the show of my guests kind of taking wellness at the speed of light and applying it to their whatever I'm interviewing them, whether it's a psychiatrist or it's somebody, an AI or whatever, everyone, it applies. We just love that. It's a great term. And it came out, my wife helped me with that, come up with that. She's just a brilliant woman, and always give credit where credit is due. So a couple of things I'm excited. So I just want to make 2 comments, and then I just want to ask you about, you talk about how it's received, and you've had some recent really big breakthroughs with some hospital systems, which is very exciting. But 2 things. One, the little thing that I wanted to bring up is, as a surgeon, again, looking at maybe having the ability, and I can't wait to be able to use these things, man, cutting down on those trays. It takes so much easier it is to open 3 trays instead of 11 from just a timing standpoint and decreasing turnovers, even for those surgeons, especially the ones that don't get swing rooms, having you can decrease. That is the biggest bottleneck, is opening the room for spine fusions. It's insane. I know a lot of people are not familiar with it, but just trust me, it can take a very, very long time, and it causes nothing but frustration for everybody, because the surgeon's walking back and forth in the room. Are you ready? Are you ready? Are you ready?
Are you ready?
And they're getting more and more stressed. It's just a vicious cycle. But even more important, when I think about this, and I just didn't think about it until you say it, talking like, if I go back this week to surgery and I even talk to the scrub techs about the possibility of knowing my next steps without me even having to communicate it for them, I think their face would just smile. I think it would just be like an automatic smile. Gee, I mean, it's like the same as giving them a bouquet of flowers. I think it's very, very exciting, and I think it's really going to change the game. And certainly when we, like we talked about earlier, I think when we do some of the previews for this, we'll show some of the actual kind of intraoperative ways that the thing works, because obviously we could talk about it until like you're blue in the face in this case, since it's your baby. But unless people actually kind of see it in action, sometimes it's hard, especially if they're not, working in OR. So kind of the last thing that I want to ask you before we wrap this up is, you've had some recent amazing successes in talking to hospital systems and starting to look at getting these things actually implemented. As we all know, sometimes it's hardest at the beginning because people need social proof, right? I could talk about all kinds of stuff, which is revolutionary and has all kinds of basic science research behind it. But until you get the next guy saying, yeah, I used it, love it, it's hard. So just breaking that social proof barrier is so important. Can you talk about some of the recent successes that eXeX has had and how that's going to propel you into the next era of eXeX?
Absolutely. You made a comment about give credit where credit was due to your wife, which is obviously important. But I feel the same way about our alpha sites. So we have some amazing alpha surgeons with Richard Geyer at TBI, Texas Back Institute. He's one of our alpha sites. Jeff Larson in Idaho. We've got Rothman Orthopedics here at Advent Health. We've got Complex Spine London, Cromwell, and London Bridge in London, and Independent Hospital. Obviously, me and my team. We've just had this amazing group of people. Nemours, John Lovejoy at Nemours Children's for pediatric scoli. And so we really accelerated through our alpha year at warp speed. And the feedback has been so powerful and so obvious. So Nemours has committed to the next level. I'm going to be talking to neurosurgery actually on Monday. They're going to come visit me in live surgery. Advent Health, we've made substantial gains. We've brought Apple Vision Pro to the OR as the world's first on multiple things. Advent Health is very, very excited by how progressive they are, how patient-centric their future vision is. There's a lot of stuff in conversation right now. I can't give details. Same in London. We've had the pleasure of creating project plans for 3 NHS trusts, of the 3 biggest trusts in all of the UK. One in cardiac, St. Bart's, one in orthopedics at Royal Orthopedic Hospital. We're doing research and, gaming out the system at Imperial College. We have a distinguished research fellow, Joseph Davids, who presented us at Harvard, Yale, and MIT at a big tech conference last week with poster boards and abstracts. We have all of this incredible machinery in play. We're going to be featured at the Wall Street Journal Future of Everything conference in New York City in May as the future of healthcare. We've got a lot of people talking to us about scale /money/funding, and those talks are ongoing, but trying to be disciplined and sober and take our time. And I'm the old fart in the group, so we're calm. We're not going to overreact. But no, things, honestly, we're only 19 months out of the gate, and I know you know that. And to see where we are 19 months since incorporation is a little bit staggering. But Sarasota Memorial Hospital just visited us 2 weeks ago, and we're already in talks about hospital-wide. They're a 400-bed hospital with 44 ORs. We see great things happening there. Right now, we've got a wait list that we strategically aren't going to accept in the short run, because right now we're building the highest level of our pyramidal structure. It's a process and support and onboarding. And so project plans have to be done in a very conservative, sane, sober, high quality way. And I'm not going to sacrifice quality for the sake of scale and opportunity. And our opportunity is bigger than our capability right now. So we're going through the beauty of growing pains, which I love. Stresses out my younger team members, but that's a sign of great progress and opportunity. So when I see that we can't handle what we're dealing with, that's a sign of success. So we're well on our way. It's really exciting.
Yeah, like I said, it's really exciting stuff. I encourage all of the viewers and listeners for this to get on the website and really see what this team is doing. And they really are going to be at the forefront of changing improving the flow, the workflow in ORs all across the world, I have no doubt they're going to be able to be successful in that. And, like you said, the waiting list is long, but you're doing it right. And people, that's just a good lesson in general for young entrepreneurs. We can all do a lot of things, but you just have to build it right. Some of it is trial and error. Some things you can afford trial and errors, and some things you can't,
Just
right?
can't.
And so you got to be really careful on what you do, but certainly are an inspiration to me and to many, many people that want to be disruptors, that want to make significant impacts outside of our small sphere of being surgeons. As surgeons, we can only take care of X amount of people, but these kinds of technologies or some of the stuff that other people have brought on the show, or even the small little thing I'm trying to do and bringing health and wellness to millions of people, this is how we're going to disrupt the status quo. Because the status quo, like you said, we can't, sitting at the 50th percentile and saying that that's okay, spending the most money per capita in the world on healthcare, but yet our health outcomes stink compared to many, many other countries stink. I want that to be emphasized. They stink. And we need to do a lot better, especially with chronic illnesses and chronic health. And it's exciting to see what's happened in the field of spine surgery. And you've been at the forefront of all of that, now changing more than spine surgery, now just changing the way surgery is done. And I saw some of the testimonials from some of these alpha sites, and people are excited, right? Total knee replacements and other types of surgeries. I want to emphasize, this is not work, this isn't surgical workflow for flow. This is going to be for everything. And that's really where the opportunity and the excitement lies. So, on that note, last thing I just want to say, you've got on your screen there, show up strong. And I think that this entire discussion that we've had is really about showing up strong, just trying to be healthy, trying to be our best selves, and then trying to give back to the world. And if we've been fortunate enough to have some level of success, we really have to show up strong every single day to make the world a better place. So in closing, where can our listeners and viewers find you? What's the best place if they want to learn about your stuff, website, LinkedIn, whatever is it, what's your preferred form of engagement if you were to direct them?
No, thank you. Definitely LinkedIn. Honestly, I was against social media 10 years ago. And my kids actually said, "Dad, you're acting old." I'll never forget. It was exactly that. And if you know me well enough, you know my buzzwords. And so they were pushing my buttons. And so it's like, okay, well, it's a tool, right? So you got to be good at a tool. Well, it turns out in retrospect, Instagram I like because I like pictures and I like cars and I like toys and planes and boats. And so I get a lot of that. But LinkedIn has been an awakening. In a weird way, I have friends that I'm really kind of close to that I've never physically met. That's how I met you, was LinkedIn. And I feel an incredible bond philosophically, mentally, cognitively with you. And yet, technically, we haven't physically met yet. LinkedIn's been that way for me. My community has exponentially grown, quality-wise, intimacy-wise, confidant-wise. There are genuinely people around the world that I could call up with a problem and ask for help. And that came out of this commitment to communication on LinkedIn, which has really been a portal. And this is not a pump for the commercial guys at LinkedIn. This happens to be a very sane, very sober way of dealing with people you wouldn't otherwise meet. And what did we have before that? We had big meetings, which I honestly stopped going to 20 years ago. And my edict then was, well, everybody says the same crap. I started going to small meetings only, because then you could actually talk honestly about stuff.
Yeah.
Well, then you're spreading yourself all over the place and it gets very insular and you can't really broaden yourself because everybody's tribal and thinks the same. And well, that's not good either. So I think using social media intelligently and conservatively to broaden my thinking, ask myself hard questions, test my logic trails has been brilliant. And so I think just communication to all the young surgeons, thirst for knowledge, thirst for questioning your rationale. Don't ever assume you're right. You're always going to beat yourself. I've never measured me versus anyone else. It's always me versus me. And am I really doing the best I'm capable of? And it's not like massive changes where you're experimenting on humans. It's tiny micro expressions with tiny little thoughts. And then you quickly know, nah, that's wrong. Let's go that way. Let's see where it goes and evolve, but pursue a lifelong journey. When we finish training and fellowship and whatever we call our certificate, it's a learner's permit. It is not the end. The number one most important thing is use that learner's permit to do something. The beautiful thing about what we do is we have the opportunity to grow lifelong. I mean, look at what you're doing. You've taken something I passionately believed in 27, 28 years ago when I was approaching the end of residency. It was like the dinosaur age when what I was thinking. And now you're going into these tiny little nano holes. I was going into rabbit holes. You're going into nano holes. So you know what? You're going to be a dinosaur someday too. So, and I hope that the people that follow you when they grow up feel the burden celebrating you by going farther than you. That's the key, is continue to push the industry forward. And my closing is kudos to everything you're doing. But we are the ultimate service industry. Living in Orlando, a lot of my good friends are high level in the really good service industries, hotels, resorts, restaurants, entertainment. Surgical healthcare could take a few lessons from those service industries, but there is no service industry more important than ours. And yes, we are the servant to our community. So I'll stop there. It's been a pleasure. Thank you so much, sir.
Well, thank you so much. I mean, it's just been brilliant. You continue to inspire me. I'm so glad that we connected on LinkedIn, which was really, it was amazing. And we just kind of have so much like-minded thoughts and what needs to be done and, going at it somewhat differently, but it's all the same. It's all part of this bigger picture of unlocking true health and wellness and living our best one life that we've got. As long as, as far as we know, we've got one life. If somebody knows something different, let us know so that we can plan a little bit, accordingly, if we're going to do this all over again, right? And so on that note, appreciate you coming on the show. It's been wonderful. We will be shouting this episode far and wide. Everybody needs to watch this. And until next time, guys, thanks for joining us today on Wellness at the Speed of Light with Dr. Robert Masson. We've had a wonderful time, and I hope you follow him on his LinkedIn and website and follow the trajectory and course of eXeX, which is going to be wonderful. And until next time, I hope you have wonderful health and happiness, and we'll see you on the next episode of the show.